I'm Dr. Malik. Today I want to talk about an important topic. See, most of my patients, when I ask them to do some exercise, particularly, see, if they are diabetics, if they are obese, when I ask them to do some sort of exercise, usually what I advise the patients is, please one day, so for example, Monday you do cycling or walking. Cycling is in your own room, have a fixed cycle. It is, don't go outside for cycling, no, it is fixed exercise cycle you do for half an hour to 45 minutes, or you can go out for walking. But walking also you must be very cautious, see that the road is very safe and it is very plain, have a nice shoe, etc. And alternate days, Monday you do this, Tuesday you do in your own house or wherever you want some sort of physical exercise by minor. See, push-ups and pull-ups, it's like dips, what we call push-ups, dips and sit-ups, like that for half an hour to 45 minutes, because this is a whole total body exercise. One day you are walking or doing cycling, and the other day you are doing push-ups and pull-ups at home. So alternate days, this is a very good exercise. But whatever I say to the patients, see, when I ask them to do exercise, you have to do exercise for half an hour to 45 minutes per day. When I say that, they immediately say, no, we are doing meditation. Good, I can't say anything about it. Even if they do meditation, they have to do exercise. That's what I tell them. So today I want to talk about this topic. In my childhood, my father used to make all our, me, my brother, my sister, all the people, every day morning we have to do asanalu means yogasanalu means different poses, shishasana, banasana, etc. About 10 to 15 varieties of asanalu we were doing regularly in the morning for half an hour to 45 minutes. So that is yoga, asanalu. Okay, this is very good for the body, to keep all your joints fit, abdomen fit, body fit, everything, all the joints flexible from childhood. If you go on doing even after 60, even after 70, if you are able to do even after 70 years, even after 60 years, if you are able to do this, it's very good. But even if you do this is flexibility of the body, and it gives very good state of mind also, very good exercise to the lungs also. But along with this, I advise half an hour physical exercise per day. The exercise should be at least 15 to 20 minutes at least per day. You must do exercise along with yoga. You do yoga regularly, but along with that, please, at least 15 to 20 minutes per day. If you do some sit-ups, some push-ups, or walking, things like this, they come under exercise. Okay, you please do it. See, don't stop your yoga or asana. They are very good. Very good for flexibility of the body, state of mind, good good to the lungs, etc. One thing. Next comes meditation. When you are doing meditation, it is mainly for your mind. It keeps your mind fit. It definitely postpones your whatever aging process, etc. But along with meditation, exercise is a must. Meditation is not an alternative to exercise, please. Exercise is different, meditation is different. You can meditate and do exercise. Okay, that's very important. And pranayama is also very good, particularly when you are doing in a very good atmosphere. For example, there are plenty of trees in your colony. You are sitting upstairs, or you are doing in a pranayama in a park. Excellent, because excellent breeze, excellent air, everything will do. Don't do it in a completely bad atmosphere. Don't do it. Good atmosphere, good trees in a park, or above your terrace if there are plenty of trees around. Please do pranayama. It is very good for your lungs, very good for your heart, and very good state of mind also. But exercise is not It is indispensable. Exercise is indispensable for everybody, whether you are 60, whether you are 70, whether you are 50 or 40 or 20. Okay, at the age of 20, at the age of 30, at the age of 40, what are all the exercises you are supposed to? I have already shown that in my early videos, video 1, video 2, video 3. And way later, when you are aging, so after the age of 40, exercise, after the age of 40, 50, 60, exercise is very, very important. So what sort of exercises you should do? See, you may do meditation, you may do pranayama, you may do asana, but please don't take exercise lightly. Exercise should be done daily, to the extent that your heart beats fast, little fast. You have slight breathlessness, and there is slight sweat. To that level only you should do exercise, and stop it. Again, give a gap. Again, start like that. Okay. And what are all the exercises you are supposed to do? Already I have been telling you. So one day you go for walking, or walking can be replaced by cycling at home. Just exercise or cycle at home, you can do it. Walking can be replaced totally by exercise. Cycling is also a very good exercise. Walking gives the same benefit as cycling. Okay, so please, you can do it at home. If you are not able to go out, not a good environment to go out, please do it at home with exercise or cycle, fixed cycle. Okay, you can do that. And one more thing is, particularly alternate days. One day cycling, walking, and one day cycling or walking, and the other day you spend on dips, sit-ups and push-ups. All joints should get involved. Your knee joint, your shoulder joint, and your hip joint, spine, they must get involved daily for at least half an hour, so that you don't land in shoulder problems, you don't land in knee joint problems, you don't land in all these things. If you continue from the age of 30 or 25, if you're continuing, don't give gaps, don't take things easy, spend some time on it, you can avoid major surgeries, by keeping your joints fit, and exercise. There are some advantages with exercise which other meditation and all don't have. See, with exercise, endorphins get released in the body, which keeps you happy throughout the day. Number two, all the joints they move, so that you don't land in frozen shoulder, knee, you can't, that is osteoarthritis knee. These things can be to some extent prevented, not completely. To some extent you can prevent by doing regular exercise and regular push-ups, pull-ups and sit-ups. You can to some extent you can prevent it. Okay, I don't say that everything can be prevented, but definitely preventable. And if you add diet to it, for example, 80% is diet, 20% is exercise. If you concentrate on diet, other things can also be, those knee joints, everything can be repaired. And you must start from a stage where they are not totally worsened. The situation is totally worsened. No, you start early, as early as possible. Don't land in situations like that. Start daily. It's half an hour per day is mandatory. So please do it. So endorphins are released. Your body you are keeping your body fit, and all the joints are completely mobile, and you are in a good state you are in a perfect state where you can dispense your duties perfectly. So please don't take easily. One patient of mine recently came to me. He retired in a good position. He regularly does meditation throughout the day. He will be, most of the time he is a retired man, he will be in meditation. So he's leading a good life. Of course, no exercise, it's only meditation. So he came to us with a bloated abdomen, and he's not passing motion for the last 4 or 5 days. But he was meditating. So we had to do surgery for his abdomen because it is totally blocked. It's not moving. We had to cut down one intestine and again resuture the end parts. So why this happened? Because he is not taking care of the bowel. So It's important at the same time when you are doing meditation, pranayama, asana, whatever it is, yoga asanas or whatever it is important to see that your bowel habit, how is your bowel habit? By the time you get up in the morning, are you passing free motion or not? That is also very, very important. It all comes daily passing motion in the morning. The moment you get up, you are going to toilet and free your no constipation, you are able to freely pass your motion. That's the best happiness on earth. Please don't forget these things. We had to operate on that gentleman, and it took nearly about 2 to 3 months for him to totally recover. Please, elderly man, it takes time, so please be careful.